Hi everybody, this is Venk with Always On EM. I'm at the ACEP Research Forum. I'm here with Sidhvi. Sidhvi, thank you so much for agreeing to share your work with us. Do you mind telling us who you are and then introducing us to your work?
Yeah, absolutely. My name is Sidhvi Nekkanti. I'm a third-year medical student at Western Michigan University Homer Schrecker School of Medicine. And today, our project here is talking about opioid use disorder and a specific initiative that we started at our regional healthcare system to sort of support the care we're providing these patients with opioid use disorder. So the basic premise behind this project was to look at the post-X waiver period. And for those of you that are unfamiliar with the X waiver period, there's a lot of barriers in physicians prescribing this life-saving medication that's been shown to really help patients struggling with opioid use disorder. Specifically, buprenorphine is a metric we were looking at to sort of help prescribe patients. After the X waiver sort of went down, there was still a lot of difficulties in patients receiving this medication. Providers were still having difficulties, especially in a healthcare system like ours, where we didn't have the necessary addiction consult services and the tools in our healthcare system specifically to sort of support prescribing this medication and overall providing support to the patients that we had. So as you can see over here, we had 2 total prescriptions of buprenorphine in the year of 2022. And that's nearly not enough when we have a pretty large population of patients that are struggling with opioid overdose. So we do know that buprenorphine does support patients. We do know that it can help the livelihoods of these patients. So we really wanted to create an approach that really supported the patients and supported our physicians and providers. And specifically, we wanted to make it quite simple. We wanted them to be able to identify patients that come into the ED that are recognized with opioid use disorder, working with our social work, recovery coach consults, really getting that inside perspective. And then moving on, we wanted to make sure we had the right resources for them to utilize to be able to easily provide this medication. We developed epic order sets and provided provider education on sort of the process we wanted to support them with. And then finally, just follow up, making sure that they're receiving the treatment that they get and making sure that we are they're continuing the treatment. And we do know that buprenorphine has been supportive in patients following up their treatment and continuing on to try and better coming out of the difficulties of opioid use disorder. So with that in mind, with that sort of simple integration system, we saw significant improvements in all the different metrics we were looking at. Specifically, the buprenorphine prescriptions, we went up to from 0% basically to about 68% of patients that are eligible for receiving buprenorphine prescriptions getting them. And then as well, getting naloxone prescriptions, continuity of care with recovery coach consults, as well as social work consults, and basically showing that with just a little bit amount of push in a system like ours where we don't have that existing addiction support, you can really make a difference. And so the basic premise from all of that is that with the proper education, with the proper initiation, and the proper integration with our entire healthcare system, you can really make a difference on these people's lives one step at a time. And as we all know, opioid use disorder is a multifaceted issue, and this is just one path that we can take. And it also opens the doors to multiple avenues to support patients. Specifically, we are now expanding this further to naloxone distribution within our community, one of which is Leave Behind by EMS. We are also starting a project with biospatial mapping, looking at opioid overdose rates, and then trying to find out where we can actually administer boxes that will allow free access naloxone for these patients. And then finally, we're building a registry for opioid use disorder patients, and so that we can continue that follow-up and make sure that they're receiving everything they can get.
That's really cool, and especially the next steps are things that I'd never really considered, but are really fascinating. And so, Sidhvi, thank you so much for what you're doing for your community and for what you shared with us. And I hope you have a great time here in Las Vegas.
Thank you.
Thank you so much.
Thank you.